Today, we are diving into a topic that can resonate with a lot of mental health professionals or people in general, and it's called imposter syndrome. Ever heard of it? I'm pretty sure you have or have experienced imposter syndrome a time or two. Whether you're a medical student, a resident, a nurse practitioner, a physician associate, a student, so forth, a college student, somebody who works a 9 to 5. Best believe at some point or another you have had to conquer imposter syndrome. It's weird how imposter syndrome can kind of creep into your life when you're trying to mind your business, and all of a sudden you start to feel like you're either not worthy or you're not good enough or you are an imposter in the role that you're trying to portray, so to speak. It causes unnecessary self-doubt. So let's explore what it is, how to manage it, and why it happens. First, let's define imposter syndrome. It is that persistent feeling of inadequacy or self-doubt. It's literally when you believe with every fiber of your being that you are not who you say you are. You're not as competent or knowledgeable as others perceive you to be, and you're an imposter, so to speak. You might even fear that you're going to be exposed as a fraud, and you're just like in this constant state of anxiety that somebody's going to figure out that you're not who you say you are. This can show up as doubting your diagnostic skills. You feel unqualified to offer advice, and comparing yourself to other colleagues that are more accomplished, more qualified than you are. And here's the kicker. Imposter syndrome is not tied to your actual ability to do your job or knowledge. It's rooted in perception. And guess whose perception is rooted in? Yourself. So why does this happen so often in anybody's life? Let's talk about it. As it relates to me as a psychiatric PA, psychiatry dives deep into the emotions of individuals. I cannot honestly do my job without understanding people's psychosocial, environmental, socioeconomics. Like, I have to get in there because everything is not organic or medication related. And sometimes I have to understand from their perspective, if I was in their shoes, how would I feel? And some of it, you hate to say it, but it's normal. And you validate that their feelings are true. So you know whether to treat or to refer, whether they just need therapy or this is a medication issue. Definitely being that psychiatry is an art and not cookie cutter, because everybody's genetics and everybody's response to medications are different. It's not one size fit all in any form of healthcare, but definitely psychiatry. And you deal with people's complex emotions, and sometimes you leave the session without getting a clean, clear-cut answer. And sometimes this ambiguity can make you self-doubt yourself. Even most seasoned professionals may end up doubting themselves and feeling unsure. Number two, you're not gonna like me, but it's the truth. In healthcare, especially as the professional, you have high expectations for yourself. We are more than likely type A most of the time. Failure is not in our vocabulary, so we're going to push it, especially the females in healthcare. We're always going to push the envelope. We're always going to try to do exceedingly and abundantly, right? But when our expectations don't match what we think they should, we're so quick to blame ourselves. And that's another reason imposter syndrome is running rampant so often. Number three, like we talked about earlier, comparison, social media, blogs, YouTube. Like, you have so many avenues to connect with the world and your other colleagues around the world, what they're doing, what they're talking about, what they're accomplishing. And someone said it before, but social media is like a highlight reel. They're only gonna display or talk about the highlights of the life. I think more and more people are starting to get away from the polished look on Instagram and other social media channels where it really is a highlight reel, but you know, going through it. But some creators have started doing that, which I'm somewhat thankful for, because it lets us know that there are humans out there. Sometimes when you compare yourself to other people, other colleagues, it makes you feel inadequate. It makes you ask yourself, why am I not doing these things? Why am I not accomplishing this? And everybody knows comparison is the thief of joy. And four, I will definitely say the stigma and silence. I know it's kind of like a bad word because you're thinking mental health professionals have stigma within the profession. Yeah, stigma is everywhere. And so, ironically, mental health professionals are great at helping other people, but not themselves. We don't have compassion for ourselves. We will not advocate for ourselves. We're used to putting ourselves on the back burner and putting everyone ahead of us. And we really struggle to show ourselves the same compassion that we give our patients. So let's talk about the impact that imposter syndrome can lead to down the line. Number one is definitely burn out. This constant self-doubt can continuously drain your energy. It's like you are your own op. So you're going to tell yourself every chance you get that you can't do this and you're not going to get it right and you're a failure and so forth. Avoidance, because in your mind you're telling yourself these things. So as a man thinketh, or as a woman thinketh, so is she, so is he. So you're going to avoid certain opportunities and challenges because you think you don't deserve them, because you're not who you say you are. And then the outcome that most people don't want to have is overcompensation. You're trying to prove your self-worth to yourself. And so you're going to burn yourself out. You're going to be running on a hamster wheel. Good news after all this dark and negative news is that you can actually use imposter syndrome to grow. I know, right? It sounds weird, but how? Let's talk about it. So number one, which is the biggest one, is just to acknowledge it. Acknowledge imposter syndrome, recognize when it shows up, and name it. And remind yourself that it's just a normal experience. It's not actually a reflection of your capabilities in any way, shape, or form, or your knowledge. Number two, I will say reframe your thinking and perception. You need to shift it. You need to tell yourself, instead of I'm not good enough, tell yourself, yeah, I give myself grace to grow and learn. And expertise is built over time. You just don't come into the profession with expertise. So give yourself grace. Number three is so overlooked and underrated, and it's celebrating the small wins. Keep yourself a journal where you write down at least one or two things a day that you feel accomplished about, no matter how small it is. If you do this over and over and over, you'll operate in a sense of gratitude, which can shift any environment. Number four, seek mentorship. Talk to someone who has been in the game for over 20 some years or 10 years and ask them, because 9 times out of 10, they have been where you are right now. They have experienced imposter syndrome. We're all human. We're all in this thing called life together. Why not have a mentor that can speak life into you and support you in that way? I will say number five, it might feel a little weird at first, but practice makes perfect. Show yourself self-compassion. Remind yourself it's okay not to know everything. Medicine is forever evolving, and we're lifelong learners. It's okay not to know everything. It's fine. It's fine. And I will say the last but not least, set realistic expectations for yourself. Like we said on the last one, medicine is forever evolving. Psychiatry is forever evolving. And it's impossible to know every single thing. Part of being a part of the field of psychiatry or any form of healthcare is embracing the uncertainty and knowing what you can tell your patients. And this came from an ethics book, I think is Dr. Brawley. He always said, tell your patients what you know, what you think, and what you believe. And that has stuck with me since PA school. I love that book. I will link it down below in the description box for anybody who likes reading about ethics or just like a good book in general. It's a really, really good book. Okay, so now let me share a personal story. I remember when I was first starting in psychiatry, I felt like an imposter. I had just took my boards, and you know, that's the smartest that you will ever be as a physician associate. You are vomiting medicine, everything, every clue, every this, every that. There is something within you that's just like, I'm the provider. Making that transition from student to provider is something that's not talked about enough, and something that people often struggle with, making that transition. So a lot of people don't talk about the shock that you go through going from a student to a professional. Then it's a realization that you go through when you're integrating yourself and you're transitioning from a student to a provider. So with my first job, it actually shaped who I am today as a provider. I'm glad my first job wasn't easy. I'm glad my first job was hard. I'm glad I took the MAT course when it was still qualified, or it was still a prerequisite for prescribing Suboxone. You had to take the 24-hour course, and I took it. And I understood Suboxone treatment and everything a whole lot more, and I was able to sit back. My job really did foster my growth. They didn't throw me into the wolves, but once I was up and rolling, I just took off. I'm still keeping in touch with from that place. I don't talk to everybody. It's amazing how that place fostered my growth. I felt like I didn't know what I was doing. I would prescribe an antidepressant. So it gave me room to make errors and to grow from them, but also for me to shape and form my own algorithms and create my own art, so to speak. And then that's when psychiatry, I really started diving in, and that's when it became fun. People look at me because I am double board certified in psychiatry and I do have my doctorate. And they're like, oh my God, you must really, 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 really know psych. I do. I know psych like the back of my hands, but I'm still learning too. Like psilocybin, and we got all these things coming out in psychiatry that's changing the world of psychiatry, all these new CMEs. It's hard to keep up with every single thing, but I'm trying my best, and I give myself space and opportunity to learn and grow, and I'm learning to give myself compassion, and I ask you to do the same. So if you feel like you're an imposter, just remember, number one, you're not alone. This is probably one of the most relatable videos on the internet, because I don't know a soul who has not experienced imposter syndrome. You need to acknowledge it, name it, reframe it, and move forward. Those are the steps we're going to take in 2025. Psychiatry needs compassionate and reflective professionals just like you. And whatever field you're in, if it's not psychiatry, your field needs you to be compassionate and reflective. And we need you to keep moving forward. We can't allow you to get stuck. So if you like this video, if it resonated with you at all, please like, comment, share, subscribe, and keep the conversation going. It's how we build community. And it's very important for me to build authentic community. And like I said, I can resonate with this one video 10 times over. Have you experienced imposter syndrome? Would you like to share your story? Do it down in the comments, and I will see you guys on the next video.